Hi, do you have knee pain? Are the treatments not working, or if they do, is the relief not lasting? Is your knee pain reoccurring or chronic? Then this video is for you. I'm Dr. Karin Drummond, owner of Drummond Chiropractic, and I'm going to share with you the 5 things I find people have when their knee is not responding to treatments. Now, I'm not going to talk about obvious things like wearing poor fitting shoes, high heels, flip-flops, because anything that causes a change in your gait is going to negatively impact your knee, or walking around barefoot on hard concrete floors. But what I am going to share with you are things you might not think about to check if you have knee pain. Now, before you try anything from any video, check with your healthcare provider to make sure it's appropriate for your specific condition. I'm making these videos to arm you with the questions you need to ask your provider if you're not getting the results you're looking for. So the first thing I want you to look at is, are your knees swelling? Maybe the knee isn't the problem. Maybe if you're sitting too much, or if you're standing too long, the lymph isn't draining from the knee. I have a whole video on lymph and how to self-massage your pain away, so go ahead and check that out. So remember, talk to your healthcare provider to see if a backup of lymph is a cause of your knee pain. Another thing I find with my patients with knee pain is they often have weak adductors or abductor muscles or other stabilizing muscles of the knee. So talk to your healthcare provider and make sure they're examining the equality of the strength around your knee. If your quads and hams are strong, but you're weak in your TFL or your adductor muscle or the popliteus behind your knee, you're going to be vulnerable to knee pain. On the flip side, if you have a super strong and tight psoas muscle, that'll also cause knee pain, because when it's tight, it pulls on the femur, causing it to twist, which torques your knee. Can you see how that's going to lead to knee pain and also make you vulnerable to injury? Another thing that can torque the knee is a collapsing arch in your foot. If your foot is collapsing, it's designed to collapse a little bit because that's part of the shock absorption. But if it collapses too much, can you see how that's going to torque your knee and make it vulnerable to injury? So if your arches are collapsing, talk to your healthcare provider to see if orthotics are an option for you to help prevent your knee from continuing to hurt again. When you're getting orthotics for knee pain, remember, you're not getting orthotics for a foot injury. You're getting it to help cushion the knee. So you don't want to overcorrect at the feet. So you don't want to get rigid orthotics, because that would be like replacing your flat tires in your car, like your flattened arches, with wooden tires. Yes, it's great for your foot, but not so great for your knee above your foot, because now it can't collapse a little bit, which is part of the shock absorption for that knee. And this is why it's good to see a provider that doesn't just look at one part of the body. Get a provider that can look at the whole body to see how each part is affecting each other. So I've talked about limping, the possible cause of your knee pain, weak adductors or abductors, too strong of a psoas muscle, a collapsing arch. What is that 5th one that might surprise you? Believe it or not, toe spacers. If your big toe is curving towards your pinky toe, can you see how that's going to change your gait and make you walk a little funny? That's going to really twist the knee as well. Just the other week, I had a patient come in. She was a runner. She had spent tens of thousands of dollars on all these treatments for her knee pain, which was getting worse and worse over time. And a simple exam with me found out all she needed was toe spacers. Since wearing toe spacers, she hasn't had any knee pain and is running marathons again. So that's where it's important to get to the root cause of your knee pain. And I can't stress enough, if you're taking pain pills for your knee pain, please stop. When you take pain pills, one, you're masking the pain, not fixing the pain, allowing you to do the activities that is going to make it worse. And if you're taking non-steroidal anti-inflammatory drugs, that actually can cause arthritis, the very thing that you don't want to get, especially if you have knee pain. So find the root cause of your pain so you can fix it instead of mask it. I hope this has been helpful to you. If it has, please let us know by clicking the like button and subscribe to our channel. And if you feel this can be helpful to somebody, please share with them. And until next time, stay well.